Okay, now today our lecture is anatomy of the foot. You have studied the hand, so the design of the foot, basic design is just similar to the hand. The foot is the region of the lower body, which is distal to the ankle joint. Okay, it supports your body weight and provides a leverage for walking and running. So it has to help walking and running, it has arches. So there are three main arches apart from its surfaces. So these arches enables it to adapt its shape to uneven surfaces. Okay. Then we can mainly divide the foot into three areas, which are tarsus, metatarsus, and digits. And it has two surfaces. Its superior surface is the dorsum of the foot, and the inferior surface is the sole of the foot. This picture shows some surface anatomy of the foot. So this is the lateral side of the foot. It shows us the lateral malleolus and the lateral longitudinal arch. And there is the calcaneal tendon. So in the surface, you can see some tendons, which are extensor digitorum longus muscle tendons. In this area, you can see the main muscle of the foot, the extensor digitorum brevis. Sorry, main muscle of the dorsum of the foot. Okay. In this picture, you can see the medial side of the foot. Here, it is the medial malleolus, and here again, it is the calcaneal tendon, and in this area, you can see the medial longitudinal arch. And this is the heel, which is formed by the mainly calcaneus muscle. And this area is the head of the first metatarsal. Okay. This is an outline of the bones of the foot. So, in the foot, we can divide the bones into three groups. First group is the tarsal bones. These tarsal bones, there are 7 and they are arranged in proximal and distal rows. So in the top proximal row, we can see the talus and the calcaneus. So in the distal row, there are medial, intermediate and lateral cuneiforms with the cuboid. Cuboid is the most laterally placed bone. And there is another bone which is called navicular, and it lies in between these proximal and distal rows. It is the bone between the talus and the medial cuneiform. The second group of the bones is called the metatarsal bones. There are 5 bones, 1 to 5, from medial to lateral. These 5 bones articulates with the distal row of the tarsal bones. So the first metatarsal bone is the thickest one, and the second metatarsal bone is the longest one. And the third group is the digital bones. All the digits have 3 phalanges. Apart from the first one, the great toe, it has only 2 bones. Okay. So the next thing is we need to know is the muscles of the foot. we can broadly categorize muscles on the foot into intrinsic muscles and the extrinsic muscles. Intrinsic muscles are the ones which originate and insert in the foot. So they are the small muscles of the foot and they control the movements of the toes. The extrinsic muscles are the ones which originate from anywhere in the lower leg. So they originate outside the foot and their long tendons cross the ankle joint and insert onto one of the bones of the foot. Now let's take muscles of the foot one by one. Okay. So first let's see what are the muscles of the dorsum of the foot. The main one is the extensor digitorum brevis muscle. It is originated from the calcaneum and the inferior extensor retinaculum and inserts by 4 tendons to medial 4 toes. It doesn't insert into the 5th toe. And it is supplied by the deep peroneal and helps in toe extension. The other one in the dorsum of the foot is the extensor digitorum longus tendon. It is a muscle of the leg. Anterior surface of the shaft of the fibula is the origin. So its tendons insert into the extensor expansion of the lateral 4 toes. It's also supplied by the deep peroneal. But the roots are somewhat different. The roots supplied to the extensor digitorum brevis is S1 and S2. And extensor digitorum longus tendon is L5 and S1. Okay. Its action is to extend the toes and to extend the foot at ankle joint. So, this is a diagram of the muscles and tendons of the foot. These are the tendons of extensor digitorum longus. And this is the extensor digitorum brevis muscle. Next are the muscles of the sole of the foot. So when we talk about the muscles of sole of the foot, first layer comprises of 3 muscles. Those are the flexor digitorum brevis, abductor hallucis, and abductor digiti minimi. The first 2 are supplied by the medial plantar and the last one, abductor digiti minimi, is supplied by the lateral plantar nerve. Flexor digitorum brevis muscle helping toe flexion. And the flexion effects on the toes are equal in any position of ankle joint, whether the foot is elevated or inverted. The action of the toe flexion has equal effect. The abductor hallucis longus muscle helps in great toe abduction. So the action is implied by its name also. And abductor digiti minimi muscle helps in 5th toe abduction. These are the muscles of first layer. Abductor hallucis, abductor digiti minimi, flexor digitorum brevis. In the second layer, you have quadratus plantae muscle. It arises from the medial and lateral sides of calcanea and inserted into the tendon of flexor digitorum longus. Its action is to assist flexor digitorum longus in flexing lateral four toes. Okay. And the other muscles are four lumbricals. The first lumbrical is supplied by the medial plantar and the remainder supplied by the lateral plantar. They extend towards at interphalangeal joints. And there are two tendons in the second layer of the sole of the foot. Those are flexor hallucis longus tendon and the flexor digitorum longus tendon. So the flexor hallucis longus tendon is supplied by the tibial nerve and it inserted into the base of distal phalanx of big toe. So it helps in flexing distal phalanx of the big toe and plantar flexing the foot and ankle joint. Also, it supports the medial longitudinal part of the foot. And flexor digitorum longus tendon is supplied by the tibial nerve. It flexes distal phalanges of lateral foretoes and plantar flexion of the foot and ankle joint. This tendon supports both the medial and lateral longitudinal arches. The next layer is the third layer of the sole of the foot. It has three muscles. First one is the flexor hallucis brevis, second one is adductor hallucis, and the third one is flexor digiti minimi brevis. So the flexor hallucis brevis is supplied by the medial plantar nerve. It flexes the metatarsalophalangeal joint of big toe and supports medial longitudinal arch. Adductor hallucis is supplied by the main branch of the lateral plantar nerve and it flexes the metatarsalophalangeal joint of big toe. And also this muscle helps to hold metatarsal bones together as a group. So the flexor digiti minimi brevis muscle is also supplied by the lateral plantar nerve and it flexes the metatarsalophalangeal joints of little toe. So this is the third layer. The picture is not very clear, I think, but you can see the small muscle layers. Fourth layer contains introcei muscles. So there are two groups of introcei. Dorsal group of introcei and the plantar group of introcei. Dorsal group has four introcei muscles. They originate from the adjacent side of the metatarsal bones and insert into the bases of proximal phalanges. Dorsal four introcei are supplied by the lateral plantar nerve. They see abduction of toes and flexion of metatarsophalangeal joints and extends interphalangeal joints. And the plantar introcei, there are three muscles. They originate from the inferior surfaces of third, fourth, and fifth metatarsal bones and inserted into medial side of the bases of proximal phalanges of lateral three toes. Okay, and they are also supplied by lateral plantar nerve. So the action of Plantar introsi is to adduction of toes. They helps in adduction of toes and flexion of metatarsophalangeal joints and extension of interphalangeal joints. And there are two tendons in the fourth layer of the sole of the foot. Those are peroneus longus tendon and the tibialis posterior tendon. The peroneus longus tendon is attached to the base of first metatarsal and the medial uniform bones. It's supplied by the superficial peroneal nerve and helps to plantar flexion of foot at ankle joint. And it everts foot at subtalar and transverse tarsal joints. And also supports the lateral longitudinal and transverse arches of the foot. The tibialis posterior tendon is attached to the tuberosity of the navicular bone and other neighboring bones, which is supplied by the tibial nerve and helps in plantar flexion of foot at ankle joint and inversion of foot at subtalar and transverse tarsal joints. So remember, peroneus longus tendon everts the foot and tibialis posterior tendon inverts the foot. Tibialis posterior tendon also supports medial longitudinal arch. All the information in this areas are seen in your Snell's regional anatomy book. You can go through them and the text and the pictures also. You will find more clear pictures of muscle layers and their attachment in your textbook. Okay. So the next thing is the arteries of the foot. So mainly the arteries supplied to the foot are the branches of posterior tibial artery and the dorsalis pedis artery. So in these pictures, you can see the dorsal surface of the foot arteries and the sole surface of the foot arteries. The sole is supplied by mainly the lateral plantar and the medial plantar arteries. And the dorsum is supplied by the dorsalis pedis artery. And it gives rise to the arcuate artery also and the digital arteries. The dorsalis pedis artery is the continuation of anterior tibial artery. It's a superficial artery which begins in front of the ankle joint at the lower end of the tibia and midway between the lateral and medial malleolus. And after running across the foot, it terminates by passing downwards into the sole between the two heads of the first dorsal interosseous muscle. So you can see dorsalis pedis artery coming from here and goes there and disappears by passing downwards into the soil. And it gives rise to the plant arch. It completes the plant arch by joining the lateral plant artery. Okay. And here, when it's passed into the dorsum of foot, it is crossed by the inferior extensor retinaculum, which lies in this area. It's crossed by the inferior extensor retinaculum and the first tendon of the extensor digitorum brevis. Okay. At the ankle joint, it is laterally related to tendon of the extensor hallucis longus. Medially related to tendon of extensor hallucis longus and laterally related to extensor digitorum longus tendon and the terminal part of the deep peroneal nerve. So it gives off three main branches. First one is the lateral tarsal artery. This lateral tarsal artery supplies to extensor digitorum brevis and the tarsal bones. Then it gives off arcuate artery. It supplies to lateral three clefts. And then it gives off first dorsal metatarsal artery. This first dorsal metatarsal artery is given off just before the dorsalis pedis artery enters the sole. Okay. And it supplies to the first cleft and the medial side of the great toe. So this is the sole artery which is supplied to the dorsum of the foot. And the sole of the foot is supplied by the medial plant artery and the lateral plant artery. The medial plant artery is the smaller terminal branch of posterior tibial artery. This artery doesn't give any contribution to the plant arch. It arrives beneath the flexor retinaculum. So this is the medial plant artery. Here you can also see the medial plant artery. Okay. Posterior tibial artery comes from here and divides into large lateral plant artery and the small medial plant artery. And medial plant artery supplies the medial side of the great toe. The other areas are supplied by the lateral plant artery. So the lateral plant artery is the larger branch of the terminal branches of posterior tibial artery. It contributes to the plant arch by joining to the dorsalis pedis artery. After dorsalis pedis comes to the sole of the foot. Here, the terminal branch of the dorsalis pedis artery emerges from the first cleft into the sole and it joins the lateral plant artery here and forms the plant arch. So this lateral plant artery gives off small muscular, cutaneous and articular branches in the sole of the foot. This artery, you can see this artery comes from the lateral side of the sole and obliquely cross the sole to the medial side. Here. First is cross the sole onto the lateral side near the fifth metatarsal bone, and then it curves medially and runs to the medial side to join the dorsalis pedis artery to form the plant arch. The next one is the plant arch. The plant arch is the one which gives rise to the plantar digital arteries. These digital arteries are the ones who gives blood supply to the toes. Okay. So there are just 3 arteries you have to remember in the foot, which are the dorsalis pedis, medial plantar, and the lateral plantar. And you have to remember what are the arteries gives rise to the plantar arch. Okay. Then we can go to the veins of the foot. So as in the upper limbs and the leg and the thigh of the foot, thigh of and the thigh and the leg, and you can see there are deep and superficial veins in the foot also. The deep veins usually follow the arteries. Those are the medial and lateral plantar veins. What you have to remember is the superficial veins. These superficial veins drains into the dorsal venous arch. You can see the dorsal venous arch on your dorsum of the foot. This dorsal venous arch is the one which gives rise to the greater saphenous vein and the small saphenous vein. On the medial side, it drains into the great saphenous vein, and on the lateral side, it drains into small saphenous vein. So this dorsal venous arch lies on over the heads of the metatarsal bones, the surface one. And the other thing you have to remember is the great saphenous vein ascends upwards anterior to the medial malleolus, and the small saphenous vein ascends upwards posterior to the lateral malleolus. Okay. Then we can go through the nerves of the foot. So there are two main nerves you have to know in the foot. Those are the medial plantar nerve and the lateral plantar nerve. Okay. So the medial plantar nerve is the terminal branch of the tibial nerve. It has muscular branches and cutaneous branches, both. The medial plantar nerve gives both muscular branches to abductor hallucis, flexor digitorum brevis, flexor hallucis brevis, and the first lumbrical. And it gives cutaneous branches to the sides of medial 3½ toes. They are nail beds and toe tips. So these are the area of the cutaneous innervation of the medial plantar nerve. And this medial plantar nerve arise beneath the flexor retinoculum of the foot. It usually runs forward to the abductor hallucis with the medial plantar artery. So there you have your medial plantar artery, medial plantar vein, which is the deep vein, and the medial plantar nerve. So this medial plantar nerve, it lies between the abductor hallucis and flexor digitorum brevis. The next one is the lateral plantar nerve. This is also the other terminal branch of the tibial nerve. So it also arises beneath the flexor retinoculum of the foot. And it also crosses the sole obliquely medial to the lateral plantar artery. So there also you got your lateral plantar artery, lateral plantar vein, and the nerve. So this lateral plantar nerve divides into deep and superficial branches at the base of the fifth metatarsal bone. Here you can see at the base of the fifth metatarsal bone, this lateral plantar nerve divides into the deep branch and the superficial branch. Okay, so it gives off branches to quadratus plantae, abductor digiti minimi, cutaneous branches to lateral part of the sole from the main trunk. From the main trunk here. This is the main lateral plantar, main trunk now. Here it gives branches to these muscles and the cutaneous branches. From its superficial terminal branch, it supplies to the flexor digiti minimi and the fourth space interosseous muscles, and lateral first and half toes, nail beds, and toe tips. From the deep terminal branch, it supplies to the adductor hallucis and second, third, fourth lumbricals, all introssi except those in the fourth intermetatarsal space. Because the introssi in this space is supplied by the superficial branch. Okay. So these are the things you have to know regarding your nerves in the foot. And this diagram shows where the areas subcutaneous dermatome supplied by the nerves. This is the dorsal surface and this is the plantar surface. So you can see here the dorsal surface area near the medial malleolus and the medial longitudinal arch is supplied by the saphenous nerve. And the first cleft is supplied by the deep peroneal nerve. And this huge area is supplied by superficial peroneal, and the area of the sole, this area supplied by medial plant. And this lateral side of the 1.5 toes and the relevant sole area is supplied by lateral plantar nerve. And this heel area supplied by the calcaneal branch of the tibial nerve. And this small area in the dorsal surface of the fifth metatarsal and the area responsible for fifth metatarsal sole plantar surface is supplied by the sural nerve. Now let's talk about some special arrangements and special structures you can see in the foot. First one is the plantar aponeurosis. This is the triangular thickening of deep fascia of the sole. and it protects the underlying nerves and blood vessels. It acts as the protective shield which protects the nerves and blood vessels. And also it supports the longitudinal arches of the foot because the plant aponeurosis is attached to the medial and lateral tubercles of the calcaneum in one side, and it goes towards the toes in the fan shape and divides into 5 slits. These slits are connected to the transverse fibers which form the superficial transverse metatarsal ligament. So, the plant aponeurosis is basically a triangular shape like this. So, suppose this is your sole of the foot. So, here you have the calcaneum bone, and to the medial and lateral tubercles, you have your apex of the plant aponeurosis is attached, and then it goes towards the toes like this. So, triangular shape one goes like that, and then it divides into 5 slits. Okay. Then these 5 slits are attached into the transverse fibers you find here, which makes the superficial transverse metatarsal ligament. So basically, it is a structure like this, and it protects the underlying veins, arteries, and the blood vessels. So the next thing, so the next one you need to know is the tarsal tunnel. This is as same as the carpal tunnel in your hand. Okay, this is the tarsal tunnel. It also contains some nerves, veins, and tendons, like in the carpal tunnel in your hand. So, this tarsal tunnel is formed on the posteromedial side of the ankle. It's on the medial side, and it has overlying flexor retinaculum. And the depression is formed by these bones. What are they? Medial malleolus of the tibia and the medial and posterior surface of the talus and the medial surface of the calcaneum and the inferior surface of the sustentaculum tali of the calcaneum. So, this tarsal tunnel contains tibialis posterior tendon and flexor digitorum longus tendon. Then tibial vein, tibial artery, and the tibial nerve. After that, more laterally, you got flexor hallucis longus tendon. So these are the structures you found in the tarsal tunnel. Similarly, as in the carpal tunnel, you can get tarsal tunnel syndrome also. in which your structures in and the contents of the tarsal tunnel are being compressed inside the tarsal tunnel. Okay. Then the other thing you need to know is the extensor retinoculum. So the extensor retinoculum of the foot consists of two parts. First one is the superior extensor retinoculum, which is a band-shaped retinoculum, and the inferior extensor retinoculum. It is Y-shaped one. And the purpose of this extensor retinoculum is to strap the tendons of these extensor muscles to the ankle region. So they will not bow during the extension of the foot and toes. It prevents the tendon bowing by keep holding the tendons together. And the structures which passes beneath or through the extensor retinoculum are the knee tibialis anterior tendon, extensor hallucis longus tendon, anterior tibial artery with venae comitans, deep peroneal nerve, extensor digitorum longus tendon, and the peroneus tertius. All the things are not clearly seen here, but you can see the tibialis anterior muscle and the tendon, extensor hallucis longus muscle and the tendon, extensor digitorum longus tendon, those things. Then, I will do a brief introduction to foot arches because you will have a detailed lecture on foot arches and the mechanism, functional aspect of the walking and gait later. So, I will give a brief introduction. So, these foot arches are the ones you can see on your foot as curves. There are three curves: medial curve, lateral curve, and the transverse one. So these curves serves as a weight bearer and a lever. So because of these curves, your foot is able to bear more weight and act as a lever in the gait, in the process of walking. At birth, all of you have three arches. First one, the medial longitudinal arch. So that one is the one you will get in the medial side of the foot here. And the lateral longitudinal arch. Lateral longitudinal arch is the one you see on the lateral side of your foot. So basically this medial one is more arch shaped than the lateral one. And the transverse one you will see this the transverse section of the foot. So you have to know what are the bones supports to and contribute to these three arches. The medial longitudinal arch is formed by the calcaneum, talus, navicular, three cuneiforms, and the first three metatarsals. This one, medial longitudinal. It is formed by the calcaneum, talus, navicular, three cuneiforms, and the first three metatarsals. The lateral one, it is formed by the calcaneus, cuboid, and the fourth and fifth metatarsals. The transverse one is formed by the cuboid and the three cuneiforms. At the base of the metatarsal bones. So, you have to know what are the maintaining factors of these arches. These arches are maintained by the shapes of the interlocking bones. So, so you can see these interlocking bones have wedge shape. Therefore, the shape of the bones prevents them to slit inferiorly and holds the arch together. And the ligaments of the foot. The ligaments you see in the foot, which holds the bones together, and the muscle action. So you have to know the basic mechanism of arch support. I mean, any arch, such as bridge. So these are the main features contribute to maintaining the foot arches. And in that, the ligaments of the foot, which are contribute to the maintaining of the arches, are the dorsal plantar and interosseous ligaments, spring ligament, short plantar ligament, long plantar ligament, and the ligaments are, and these ligaments reinforced in the action by the plantar aponeurosis. As I said earlier, the plantar aponeurosis plays a major role in keeping the shape of the longitudinal arches. So apart from these ligaments, there are principal muscles which are concerned in maintaining the shape of the arches. Those are peroneus longus, tibialis anterior and posterior, flexor hallucis longus, and the intrinsic muscles of the foot. And there are other muscles which also involved in maintaining the foot arches. Those are the flexor digitorum brevis muscles, medial part, abductor hallucis, and the medial part of flexor digitorum longus, and the flexor hallucis brevis. So, all those ligaments and the muscles and the principle of foot arches, these things are clearly described in your Smith's anatomy book. And there will be a separate lecture from Jayapati Madam on foot arches. Okay. I have put a small clinical note on plantar fasciitis. Plantar fasciitis is the inflammation of the plantar fascia. So it occurs in individuals who do a great deal of standing or walking, causes pain and tenderness of the sole of the foot. So when there is repeated minor trauma into the plantar fascia, there will be inflammation in those repeated minor trauma occurring places. So it causes pain and tenderness of the sole. So when this condition is not treated and the repeated attacks continue to happen, this may induce the ossification of the posterior attachment of the aponeurosis. It will form a calcaneal spur. This is a small clinical note. And there are some other things like the changes of the attachment shapes of the joints and other things. And you will also have another separate lecture on joints of the lower limb. So the joints of the foot will also be discussed in that one. But just to know, there the joints are just same as in the hand. You have tarsal joints and tarsometatarsal joints, intermetatarsal joints, and metatarsophalangeal joints, and interphalangeal joints. Those things will be discussed in the lecture on lower limb joints. In a summary, we have discussed about the surface anatomy and the bones and the muscles, vessels, nerves, and some extra points on plant aponeurosis, tarsal tunnel, extensor retina. So, thank you. This is the end of your lecture. I think I have given 2 hours, but only I spent 1 hour, so you can go through your lecture again, and I will upload this PowerPoint presentation and the PDF version to the Moodle. You can get it from there, and just use this lecture as an outline for the anatomy of food. Don't based on everything on the lecture. Okay, use as a guide and go through your textbook to gain some more knowledge, to memorize the pictures, and I know you will have, you all must have some MCQs, fast MCQs with you. Just go through the MCQs which are from the foot, anatomy of the foot, and go through some SCQs, also fast SCQs on the next hour. So I will give you a time of hour to go through past papers and the past MCQs if you have. And you will be able to have more thorough knowledge. I think, do you have any questions? If you have, you can ask them. Considering your silence, I think questions. Okay. Then we will finish the lecture here.
Thank you, madam.
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 Thank you, madam. Thank you, madam.
Thank you, madam.
My
Thank
lecture or
Thank
the
you,
video
madam.
conducted
Thank you, madam.
contents, please free to send the email or drop a word at the department. Okay.
Okay, madam. Thank you.